Nais kong pasalamatan pala ang leadership, natapos na leadership, ang outgoing leaders ng Harvard Kennedy School Alumni Association Philippine Chapter sa kanilang pagbigay ng ang Harvard Veritas Medal sa inyong lingkod kamakailan sa Alumni Association homecoming nung nakaraang Huwebes. Maraming salamat sa outgoing chairperson ng Harvard Kennedy School Alumni Association Philippines. Ang outgoing chair ay si dating Secretary Rafi Alunan at ang outgoing president ay si Attorney Tony Abad. At congratulations sa bagong Board of Trustees ng Alumni Association. Hindi pa nakakapag-elect ng kung sino ang magiging chairman or president, pero nakapag-elect na po ng mga opisyal, at isa sa mga naroon ay si Professor Noel Leyco na dating Pangulo Pangulo ngayon ng Pamantasan ng Lungsod ng Maynila at dating Undersecretary ng DSWD. Professor Leyco, maraming salamat and congratulations. At of course si Annalyn Luntok, maraming salamat. I was happy to meet the alumni of the Harvard Kennedy School, dating JFK School of Government, na nagkaroon ng homecoming nung nakaraang Huwebes. Maraming salamat sa medal na ipinagkaloob ninyo sa amin, at welcome sa mga bagong miyembro ng HKSAAA Philippines, and congratulations sa mga contribution ninyo sa ating pamahalaan at sa ating lipunan. Maraming salamat sa inyo. Alright, nasa kabilang linya natin, ito ho ay dating Medical Director ng Pfizer. I need to mention that Pfizer. Tapos matagal ho siya sa PhilHealth, isang policy expert, dating advisor ng IITF, National Task Force on COVID. At tinutukoy ho natin si Dr. Tony Leachon. Dr. Tony, magandang umaga ho sa inyo. Dr. Tony, good morning.
Magandang umaga, Dr. Cesar. Good morning, kumusta po kayo?
Alright, kayo, kumusta? Dr. Tony, long time no hear. Long time no see. Well, at least sa akin, pero I'm sure lagi naman kayong naiimbitahan, hindi lang ng Manila Broadcasting Company but other networks and media institutions. Of course, civil society, sapagkat sought much speaker ho kayo. Dr. Tony, tumawag kami sapagkat 9 days to Pasko, 8 days to Pasko. Maraming mga reunion ang nakikita. Halimbawa, binabanggit ko, katatapos lang ng reunion ho namin sa Harvard Kennedy School Philippine Chapter. Siyempre, kainan nung college, nung ibang mga trabaho. Kami ho, sa mga Senate reporters ng 1980s, nag-reunion. Daming pagkain, maraming inuman. Sabi ko, tawagan natin si Dr. Tony. Baka nakakalimutan ng ating mga kababayan ng mga katulad namin na uma-attend ng party. Ano ba dapat nating pag-ingatan ngayong Kapaskuhan para hindi tumaas ang alta presyon ang atake sa puso? Dr. Tony.
Well, Dr. Cesar and sa mga kababayan natin, meron talagang pag-aaral niyan at nagkaroon ng publication yan sa circulation, isang medical journal, started 1973. At doon na-discover that during the holiday season, starting let's say from November 28 after the Thanksgiving, tumataas ang bilang ng heart attack at stroke. Ang pinaka-merriest time of the year, Christmas, pero yun ang pinakamaraming cause of death globally. And then ang susunod na delikadong araw ay December 26 at saka January 1. So it peaks, nag-start after Thanksgiving Day. Sa atin naman, it starts December 1. And considering isa tayo sa pinakamahaba ang Christmas holiday season, dahil ang mga parties and all, walang pinag-iiba. So ito, hindi yan anecdotes, no? I used to have many admissions in the ICU kahit mga 20 or 30 years ago. At nagugulat ako, it will come at a time na paalis ka ng bansa for a vacation. And many theories have been put forward, but these are already established concepts. One of the concepts, Cesar, is that bumababa yung temperature globally. And even in the Philippines, bumababa ang temperatura. Nakikita naman natin kahit sa Maynila ngayon, maabot tayo ng 17 or in Baguio, maabot tayo ng mga 8. No? So globally, pagbaba ng temperature, kumikitid yung arteries natin. So that's number one reason. Now, the other one, in countries na hindi malamig, marami ring namamatay is because of the overindulgence sa pagkain. Kasi no other month na kakain tayo halos handaan. At in the Philippines, minimum lechon kasama yun eh. Walang party na hindi masaya pag walang lechon. So any other month, wala ka naman masyadong holiday. But December to us is festive. Lalo na ngayon may mobilization tayo. And then number 3, a lot of parties, meron drinking doon, alcohol drinking, may holiday heart syndrome na tinatawag na nagkakaroon ka ng irregular beat pagka ikaw ay umiinom. And then, of course, with drinking, andun yung smoking. And then, of course, kung puyat ka, hindi ka nakaka-exercise. And basically, you gain about 4 to 6 or 4 to 8 pounds during the holiday season. So therefore, tataas ang cholesterol mo, ang sugar mo, tataas din, of course, ang blood pressure. And most patients who are high risk to develop a heart attack, nagkaka-heart attack at the time na kailangan natin yan. So, and then you have the mental stress related to the holiday season, financial problems, maraming gagastusin during the holiday season, kulang ang tulog, pag kulang ang tulog, wala tayo sa kondisyon. And then lately, ni-research natin, a lot of famous personalities died December. If you remember, the late movie king Fernando Poe Jr. died on December 14. And I think he was in a party with some senators. And then lately, a week ago, famous singer Jobit Baldivino just dropped, no? And then based on the report, meron siyang ischemic stroke. At 29 years old, imagine mo. And then dun sa FIFA, Qatar, Grant Wall, a prominent sports editor, nag-drop dead lang dyan sa Qatar. So what I'm trying to say, Carrie Fisher also died on Christmas Day, and then followed by the mother of Carrie Fisher the day after. So ibig sabihin natin, if you're gonna look at the internet, there are famous personalities, but not only famous personalities, but common na mga tao na namamatay during the holiday. My uncle died at age 40 when I was in grade 6. Nagme-merry making sila. It was Christmas, umiinom, sisigarilyo. And then suddenly, my uncle dropped dead. Namatay siya at age 40. That was in 1973. And then, very vivid sa akin yung memory yun. So, itong pinagsasabi natin ngayon is not new. Is that we need to re-educate the public para sa ganun, makapag-imad kayo during the holiday season. It is the merriest time of the year, but it is the deadliest time of the year as well.
Bah, first time kong narinig yun ah. Merriest time of the year, but also deadliest time of the year. And there's a practical implications of that, and historical data will also prove that is correct, hindi ba? So, syempre, alam na natin yon na mag-iingat ho tayo sa pagkain. Ano? Mukhang natumbok ko ninyo. This requires public education. This requires to be initiated by the government, hindi ho ba, Dr. Tony? Yung mga katulad niyo nagsasalita, but the advocacy and the communication component has to be done institutionally initiated by the government. Na natumbok ko ninyo, Dr. Tony.
Well, tama ka dun, Cesar. It's just that it's the Christmas season and na-highlight
Everyone
natin.
is busy.
And I don't want...
Everyone is busy. Everyone is busy.
Everyone is busy, pero I don't want to rain the parade, ika nga. Ako, kung kailangan natin ng solution, if there's one thing that I'd like to request, sana some of our legislators will file a bill to insert into the curriculum preventive health education. Kasi mas cheaper siya. Let's say, it will go into bata pa lang. Kasi most of the persons ngayon na nagkakasakit ng lifestyle diseases, we call it lifestyle diseases or non-communicable diseases. If you look at the Department of Health data, ang 4 killers natin ay lifestyle diseases. I will name it. Number 1 is coronary artery disease, sakit sa puso. Number 2 is stroke due to hypertension. Number 3, cancer. And number 4, diabetes. Number 5, of course, COVID. Top 4 yan. At ang economic impact niya sa economy is 200 billion. So do you know that the number 2 na binabayaran natin sa PhilHealth, a staggering 12 billion, is secondary to dialysis. And ang cost niyan ay diabetes and hypertension. So ang ibig sabihin, we need to take it on the preventive side kasi mas mura siya. And we can save the young and the poor na wala namang kakayanan makapagbayad pag na hospital na. So what I'm saying, sana with the support, let's say, of Vice President Sara and some legislators, this is actually game-changing eh. Kasi imagine mo, Dr. Cesar, with the brain drain, with the doctors and nurses going out of the country to seek greener pasture, but if you empower every Filipino to become educated on not to smoke, on not to drink, what to eat, maaral lang nila yung food plate, to exercise daily before the classes, mental stress will be solved, their body weight nila malalaman natin. So it starts with education eh. And when there's education, behavior will follow and then attitude. Mm-hmm. The second thing, and then i-insert na rin natin yan sa DOLE so that the DOLE can actually influence the business establishment to establish that in the DOLE and then in the community, the DILG. Sa DILG, what they can do is to make bike lanes, yung mga walk lanes and all, and then parks, o may kaakibat na infrastructure dyan eh. And then of course, meron dyang sin taxes eh. Taasan pa natin yung sin taxes natin for tobacco, alcohol, and then sodas, so that yung money generated from the taxes of these abusive substances can actually be used by the Department of Health and the PhilHealth to pay for those who will be admitted. So, kaakibat yan eh. So, what I'm saying, education, legislation through executive order or a law, and then sin taxes, raise pa natin, that will be needed for universal health care.
Yes.
Kasi nung na-approve ng sin tax in 2012, 50 billion lang ang budget ng Department of Health. Ngayon, quadruple na because of the sin taxes.
Okay.
And then, with the DPWH, they need to create an environment for change that is healthy for living.
Okay. All right. Very, very comprehensive. Short, but very, very comprehensive. Pero siguro sa mga susunod na discussion, I go back to the public education component should be included, integrated, incorporated in the curriculum, basic education, itong preventive medicine. Alright, Dr. Tony, maraming salamat. As usual, marami kaming natutunan sa inyo. Happy holidays, happy weekend, and advance Merry Christmas to you and to your family. Maraming salamat po.
Thank you, sir, and to the DCRH. And Merry Christmas and stay safe, everyone. Happy holidays.
Alright, si Dr. Tony Leachon. Maraming salamat ho sa inyong pagsubaybay sa ating palatuntunang special on Saturday. Ako po si Cesar Chavez. Nakasama nyo kanina alas 7 ng umaga hanggang bago mag alas 9 ng umaga. Maraming salamat po. And happy weekend, everyone.
Ang 24th KBP Golden Dove Awardee at Rotary Club of Manila Centennial Public Service Radio of the Year Awardee, Mr. Public Service, Cesar Chavez.
Tingnan nyo, oh, puti ito. Mas puti ito.
Mas puti ito, mas puti ito, mas puti ito.
Sa Pride Bar, pwedeng hindi na mag-bleach, tina o anyel. Dahil ang Pride Bar ay may power whitener na nanunuot sa bawat ibla. Kaya ang damit ay kislap puti at banayad pa sa kamay.
Mas puti ito, mas puti ito. Mas puti ito.
Pride Bar, hindi lang puti, kislap puti.
ACS.
At dahil 10 araw lang ang pagitan ng birthday ko at ng Christmas, pag-iisahin ko na lang yung wish ko. Siyempre ay makasama ang aking family sa isang maybe out of town trip. At siyempre, hindi rin siyempre mawawala ang barkada. Sana makapag-reunion kasama ang mga friends. Kaya naman, ikaw ba? Anong wish mo this Christmas? I-share mo na yan sa social media at gamitin ang official hashtag na hashtag DZRH sana ngayong Pasko. At malay mo, wish mo ang mapili naming tuparin sa panahon ng Kapaskuhan.
New Champion Super Power Detergent. Tanggal ang pintura, dugo, juice, sutek, toyo, mantika, ketchup at iba pa sa X-Stain Technology. Max linis, max sulit. New Champion Super Power Detergent with X-Stain Technology.
No! Credited na!
Oo, alam ko. May GSIS touch na.
Ang wish ko ngayong Pasko, may pagkain sa hapagkainan na mapagsasaluhan ang bawat pamilyang Pilipino upang sama-sama nilang damhin ang tunay na diwa ng kapanganakan ng Panginoong Hesukristo at yun ay ang pagmamahalan. Ikaw ba? Anong wish mo this Christmas? I-share mo na yan sa social media at gamitin ang official hashtag na hashtag DZRH sana ngayong Pasko. Malay mo, ang wish mo ang mapili naming tuparin sa panahon ng Kapaskuhan. Merry Christmas and a Happy New Year!
Ka-Blue!
Charm that corn, bangong kumaka-bloom. Charm that corn, damit ay may bangon ng salibong bulaklak.
Charm Fabric Conditioner with Stay Fresh Technology. Damit ay ka-bloom sa bango.
Charm that corn, bangong kumaka-bloom. Charm that corn, damit ay may bangon ng salibong bulaklak.
Charm Fabric Conditioner. Bangong ka-bloom.
ACS.
Tinesting, sinuri, siniyasan. Ang resulta? Super effective ang Shield sa pagpatay ng bakterya at virus. Shield Antibacterial Soap. Believe ang mga eksperto sa Philippine Nurses Association. At si Mami.
Tiwala ako sa Shield.
Shield Antibacterial Soap. Napatunayang mabisa. Ang mga nurse, tiwala.
ACS.
New Champion Super Power Detergent. Tanggal ang pintura, dugo, juice, sutek, toyo, mantika, ketchup at iba pa sa X-Stain Technology. Max linis, max sulit. New Champion Super Power Detergent with X-Stain Technology.